Stop sleeping like that. Seriously, that position you have been sleeping in for the past 30 or 40 years might actually be destroying your health right now. And here is the scary part. You will not feel the damage until it is already done. If you are over 60, the way you sleep matters more than you ever imagined. This is not just about comfort anymore. This is about your heart, your brain, your spine, and even how long you live. A groundbreaking study published in the Journal of Clinical Sleep Medicine followed over 12,000 adults for nearly a decade. What they found shocked the medical community. Certain sleeping positions increased the risk of cardiovascular events by up to 34% in older adults. 34%, just from how they positioned their body at night. But wait, it gets even more alarming. Research from Stony Brook University discovered that sleeping in the wrong position can actually reduce your brain's ability to clear toxic waste by over 40%. That toxic waste includes amyloid beta proteins. Those are the exact proteins linked to Alzheimer's disease. So, while you think you are resting, your brain might be slowly accumulating damage. Now, before you panic, here is the good news. Scientists have also identified the positions that protect you. The positions that actually boost your circulation, support your spine, and help your brain clean itself properly while you sleep. And making these changes is completely free. You do not need any special equipment. You do not need medication. You just need to know what to do and what to avoid. In this video, I am going to walk you through the 4 sleeping positions that people over 60 must stop doing immediately. More importantly, I will show you exactly what to do instead. I will explain the science behind each one. I will give you the specific techniques to make these changes comfortable. And I will share the real numbers from actual clinical studies so you can see just how much difference these simple switches can make. We are going to count down from number 4 to number 1. I saved the most important position for last because what researchers discovered about it genuinely surprised me. A 2023 study from Stanford found that this single position changes reduced nighttime oxygen drops by an incredible 61% in seniors with breathing issues. 61% improvement from just changing how you lie down. Stick around for that one because it could genuinely change your life. Let us start with number 4. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment, so drop your comments below. Now let us start with the position number 4 and work our way up to the most important one. Number 4. Avoid the twisted torso position. Try the aligned spine position instead. The twisted torso position is something millions of people do without even realizing it. This happens when your upper body faces one direction while your hips and legs twist the opposite way. Maybe you sleep on your back but your knees fall to one side, or you lie on your side but your shoulders rotate toward the ceiling. This creates a corkscrew effect through your entire spine. When you are younger, your spine can handle this occasional twisting. Your discs are hydrated and flexible. Your muscles recover quickly overnight. But after 60, everything changes. A study published in Spine Journal examined MRI scans of over 300 adults aged 60 and above. They found that 72% showed significant disc degeneration in the lower back. When you add rotational stress from sleeping twisted, you accelerate this damage dramatically. The problem is that this position creates uneven pressure distribution across your vertebrae. Your facet joints, those small connectors between each vertebra, get compressed on one side and stretched on the other. Over time, this leads to inflammation, stiffness, and chronic lower back pain. Researchers at Johns Hopkins found that adults who reported sleeping in twisted positions were 2.3 times more likely to experience morning back stiffness lasting over 30 minutes. But here is what most people do not know. The twisted torso position also affects your internal organs. When your spine twists, so does your torso. This can compress your stomach and intestines, leading to acid reflux and digestive discomfort. A study in the American Journal of Gastroenterology found that seniors who slept in twisted positions reported 47% more episodes of nighttime heartburn compared to those who maintained spinal alignment. The solution is the aligned spine position. This means keeping your shoulders, spine, and hips all facing the same direction throughout the night. Think of your spine as a straight line from your neck to your tailbone. Everything should point the same way. To prepare for this position, start by lying on your side with a pillow between your knees. This pillow is crucial. It prevents your top leg from pulling your hips forward and creating that twist. The pillow should be thick enough that your knees stay hip-width apart. If you tend to roll onto your back during the night, place a body pillow or rolled blanket behind you as a gentle barrier. For maximum benefits, make sure your mattress supports your body's natural curves. A medium firm mattress works best for most seniors, according to research from Oklahoma State University. Their study found that participants who switched to medium firm mattresses reported 48% less back pain after just 4 weeks. Also consider using a contoured pillow that supports your neck's natural curve. This keeps everything in line from your head down to your pelvis. Now let us move to position number 3, which affects something even more critical. Number 3. Avoid the arms overhead position. Try the arms down position instead. Sleeping with your arms raised above your head feels natural to many people. Some fold their arms under their pillow. Others stretch them straight up beside their ears. It might feel comfortable when you fall asleep, but the damage happens during the hours that follow. When your arms stay overhead for extended periods, you compress the nerves and blood vessels in your shoulders and upper arms. This is especially problematic for people over 60 because of something called thoracic outlet syndrome. The thoracic outlet is a narrow space between your collarbone and first rib where nerves and blood vessels pass through. Age-related changes make this space even tighter. Raising your arms overhead further compresses this area. A clinical study from the Cleveland Clinic tracked 180 seniors who complained of numbness and tingling in their hands. 63% reported sleeping with their arms overhead regularly. When researchers had them change to an arms-down position, 71% experienced significant improvement within 6 weeks, just from changing arm position during sleep. But circulation is not the only concern. The overhead position also creates chronic tension in your rotator cuff muscles. These 4 muscles stabilize your shoulder joint. After 60, rotator cuff tendons naturally become less elastic and more prone to tears. Research published in the Journal of Shoulder and Elbow Surgery examined over 500 adults aged 60 to 80. They found that 40% had some degree of rotator cuff damage, with many experiencing no daytime symptoms. Sleeping with arms overhead stresses these already vulnerable tendons for 7 to 8 hours every night. The arms down position is simple but requires conscious practice at first. Keep your arms at your sides or resting gently on your chest and abdomen. Your elbows should stay below shoulder level at all times. This maintains proper blood flow and removes stress from your shoulder structures. To prepare for this change, start by tucking a small pillow or rolled towel under each arm when you lie down. This creates a comfortable resting spot that discourages raising your arms. If you normally hug a pillow while sleeping, switch to holding it at chest level rather than over your head. A body pillow works wonderfully for this because you can wrap your arms around it at a safe height. For maximum benefits, do some gentle shoulder stretches before bed. This releases the muscle tension that often drives people to raise their arms unconsciously. Simple shoulder rolls and doorway stretch for 30 seconds each can make a noticeable difference. The European Journal of Physical and Rehabilitation Medicine published research showing that evening stretching reduced nighttime arm repositioning by 38% in seniors. Here is a transition to something that affects your heart directly. Number 2. Avoid the right side sleeping position. Try the left side sleeping position instead. This one surprised most people. Sleeping on your right side seems harmless enough. But for anyone over 60, especially those with any heart concerns, the right side can actually stress your cardiovascular system unnecessarily. Your heart sits slightly left of center in your chest. When you sleep on your right side, gravity pulls your heart toward your right lung. This does not sound like much, but it creates measurable changes in heart function. Research from the Journal of the American College of Cardiology used echocardiography to study heart position during sleep. They found that right side sleeping increased cardiac volume by approximately 8% compared to left side sleeping. For a healthy young heart, this is negligible. For an aging heart, especially one with any existing weakness, this extra workload adds up over thousands of nights. The effects become even more significant if you have conditions like congestive heart failure or atrial fibrillation. A study published in the International Journal of Cardiology followed 240 patients with heart failure. Those who predominantly slept on their right side had 23% more hospitalization events over 3 years compared to left side sleepers. 23% more hospital visits simply from sleeping position. But let us talk about something most doctors never mention. Your stomach and pancreas are on the left side of your body. When you sleep on your right side, gravity does not help empty your stomach. Food and acid can pool and reflux back up your esophagus. A study from the Journal of Clinical Gastroenterology measured reflux episodes in both positions. Right side sleeping increased reflux events by almost 40% compared to left side sleeping. The left side sleeping position solves these problems elegantly. Gravity now helps your heart pump more efficiently. Your stomach drains better. Even your lymphatic system, which removes waste and toxins, functions more effectively because the main lymphatic duct drains into veins on the left side of your body. To prepare for left side sleeping, understand that habits take time to change. Start by placing a body pillow behind your back when you lie on your left side. This prevents unconscious rolling to your right during the night. Some people find it helpful to sew a tennis ball into the back of their sleep shirt as a gentle reminder not to roll right. For maximum benefits, elevate your head slightly with an extra pillow or use a wedge pillow. Research from the American Journal of Gastroenterology showed that combining left side sleeping with a 30-degree head elevation reduced nighttime reflux by an incredible 90%. Also consider placing a pillow between your knees to keep your hips aligned. This prevents lower back strain while maintaining the healthy left side position. And now for the number one position, the one that researchers say matters most. Number 1. Avoid the flat back sleeping position. Try the elevated back sleeping position instead. If you only change one thing after reading this, let it be this. Sleeping completely flat on your back might be the most dangerous position for anyone over 60. And I am not exaggerating when I say it could literally save your life to make this change. When you lie flat on your back, gravity pulls your tongue and soft tissues backward toward your throat. This narrows your airway significantly. For young people with strong muscle tone, this rarely causes problems. But as we age, the muscles in our throat lose their firmness. A study from the American Academy of Sleep Medicine found that adults over 60 have 33% more airway collapse during sleep compared to younger adults in the same flat position. This leads to something called sleep-disordered breathing, which includes snoring and sleep apnea. These are not just annoying conditions. They are genuinely dangerous. When your airway closes during sleep, your oxygen levels drop. Your brain has to partially wake you up to restore breathing. This can happen dozens or even hundreds of times per night without you consciously realizing it. Here is where the numbers become truly alarming. Research published in the New England Journal of Medicine followed over 6,000 adults for an average of 8 years. Those with untreated sleep apnea had a cardiovascular mortality rate 4 times higher than those without the condition. 4 times higher risk of dying from heart disease. And the flat back position makes sleep apnea significantly worse. But this is not just about breathing. That Stanford study I mentioned in the introduction specifically examined head elevation and oxygen saturation. They found that raising the head by just 20 to 30 degrees reduced oxygen desaturation events by 61%. This means 61% fewer episodes where oxygen dropped to dangerous levels. The improvement was most dramatic in people over 65. The flat back position also worsens acid reflux for obvious reasons. When flat, stomach acid easily travels up your esophagus. This causes heartburn and can even damage your esophageal lining over time. Chronic acid exposure increases the risk of a condition called Barrett's esophagus, which can become precancerous. A meta-analysis in the Archives of Internal Medicine found that sleeping flat doubled the risk of nighttime reflux symptoms compared to elevated sleeping. There is also the issue of brain health that we touched on earlier. Research from Stony Brook University using dynamic contrast MRI showed that the brain's glymphatic system, which clears toxic proteins during sleep, works best with proper head elevation. When flat, this waste clearance dropped by approximately 40%. These toxic proteins include the amyloid beta associated with Alzheimer's disease. So, every night spent flat on your back could potentially contribute to cognitive decline. The elevated back sleeping position is the solution researchers recommend most strongly. This involves raising your upper body between 20 and 30 degrees from horizontal. This angle keeps your airway open, helps your stomach drain, and optimizes your brain's cleaning system. To prepare for this position, you have several options. The simplest is using a large wedge pillow under your regular pillow. These are inexpensive and available at most home goods stores. Make sure the entire upper body from your hips upward rests on the incline. Just propping your head up with extra pillows creates a chin-to-chest angle that actually worsens breathing and causes neck pain. An adjustable bed frame is the gold standard for this position. Modern adjustable bases allow precise control over head and foot elevation. Research from the National Sleep Foundation found that 78% of people with adjustable beds reported improved sleep quality. The average user raised their head section by 22 degrees, right in the optimal range. For maximum benefits, combine the elevated position with side sleeping if possible. This means lying on your left side with your upper body elevated. You get the heart benefits of left side positioning, plus the airway and reflux benefits of elevation. A study in sleep medicine compared various position combinations and found that elevated left side sleeping produced the best overall outcomes for seniors with sleep breathing issues. If you cannot afford an adjustable bed or wedge pillow, you can create a makeshift incline using firm pillows or even a foam pool noodle under your mattress at the head end. The key is creating a gradual slope rather than a sharp angle. Some people place bricks or risers under the legs at the head of their bed frame to achieve a gentle whole body incline. Start gradually if the elevation feels strange at first. Begin with just a 15-degree elevation for a week, then increase to 20 or 25 degrees. Your body needs time to adjust to the new position. Most people find it comfortable within 2 weeks. Let me summarize what we covered today, because this information is genuinely important for your health. Position number 4 was avoiding the twisted torso and switching to the aligned spine position. Keeping your shoulders, spine, and hips facing the same direction prevents disc damage and reduces morning stiffness significantly. Use a pillow between your knees and maintain proper spinal curves. Position number 3 was avoiding arms overhead and keeping your arms down at your sides or on your chest. This protects your rotator cuff tendons and prevents nerve compression that causes numbness and tingling. Use small pillows to create comfortable arm resting spots. Position number 2 was avoiding right side sleeping and choosing the left side instead. This helps your heart pump more efficiently, improves digestion, and reduces acid reflux by up to 40%. Use body pillows to prevent rolling to your right side during the night. Position number 1, the most important change you can make, was avoiding flat back sleeping and elevating your upper body 20 to 30 degrees. This single change reduced dangerous oxygen drops by 61% in studies. It protects your heart, clears brain toxins more effectively, and dramatically reduces reflux symptoms. These changes cost nothing to implement. They require no medication. They have no side effects. Yet the research shows they can meaningfully reduce your risk of heart disease, cognitive decline, chronic pain, and sleep-disordered breathing. Here is my challenge to you. Pick one position change tonight. Just one. Master it for 2 weeks before adding another. Within 2 months, you can transform your sleep quality and protect your long-term health. Your body repairs itself during sleep. Your brain consolidates memories. Your heart gets its only real rest of the day. Do not let a simple thing like sleeping position undermine all that healing potential. If you found this information helpful, please share it with someone over 60 who you care about. They might not know that such a simple change could make such a profound difference. And remember to speak with your doctor before making significant changes if you have existing health conditions. Sleep well and sleep smart. Your future self will thank you. I want to hear from you. Which sleeping position have you been using for years that you now realize might be causing problems? Drop it in the comments below and let me know if you are ready to make the switch tonight. Now, we want to hear from you. Do you or someone you know struggle with finding a comfortable sleeping position? What problems have you noticed from sleeping the wrong way? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.